one is your chest up against...
It's more than 2 months since Tom Mayer was discharged from hospital, but the virus left him enfeebled, and now he's back for a chest x-ray.
What I am trying to find out is whether there's any permanent damage or not.
Scarring people talk about, don't they?
Yeah, possibly.
Back in April, struggling to breathe, Tom was given oxygen under pressure and started to improve. He spent weeks rebuilding his strength.
So going up and down the stairs, that was a bit difficult. Took some walks around the garden and just around the village. And then fairly quickly, within 3 weeks, I took a longer walk. But I noticed any slight slope, I'd quickly get out of breath.
Shoulders forward slightly.
Tom will soon find out whether his lungs are clear of the scarring, and his story is far from unusual. We saw Helen Benfield on our last visit tending patients on the COVID ward. She's all too familiar with the long recovery needed by many of those she's treated.
The fatigue that patients are having after when they're recovering has been absolute. They are really, really tired and wiped out by COVID. So it's just taking that much longer for them to be able to bounce back to normal.
It's not easy for a hospital to bounce back either. Even if acute coronavirus cases have plunged, there were just 3 on this day compared to more than 100 on a previous visit. That means departments like cardiology can get back to work and people return to their normal duties.
In a normal heartbeat, we will have a normal electrical conduction which should start up here.
For Kirsty Castle, that means transferring back from intensive care, where she'd nursed COVID patients, to her usual job in the arrhythmia clinic seeing outpatients.
We're having to change how we work dramatically. You have to maintain social distancing for both staff to keep staff and patients as safe as possible.
It's cast a long shadow.
It has, it really has, yeah.
And that shadow affects almost everything that goes on here now. Coming back here again, what we're finding is a hospital striving to get back to some sort of normality. But for the patients and for the institution itself, it feels like it could be a long road to recovery. Upper level day surgery has resumed, and this patient needs a battery change on his pacemaker. They're keen to make inroads into the waiting lists that swelled under lockdown. But while this man was happy to come in, coronavirus has left a real legacy of fear in the community.
We normally see 10 to 12 heart attacks a week, but at the peak of lockdown, we were down to 1, 2, and there were some weeks there weren't any at all. And we were really concerned that a lot of our patients weren't coming in, and we're going to suffer long-term health consequences because of lack of presenting when they should have done. Even now, patients are still very scared of coming into the hospital. Around 50% of the people we phone to come in for an elective procedure still don't want to come in, and there's going to need to be a lot of work around that to persuade them to come back in.
In what sense is it harder to stand it all up again than it was to shut it down?
It was easy to lock down and to stop everything, but getting back to normal is essentially restarting and rewriting a whole pathway for our patients in every single area.
Morning, and patients arrive at the newly established COVID testing centre. Everyone coming up from a procedure will be swabbed 2 to 3 days before admission and must avoid contact with others for a fortnight.
You had to do a self-quarantine, didn't you, before coming in today?
Yes, yeah. I've been at home anyway, so it's not been too much of an issue for me.
Is that because you're vulnerable? Or?
Yeah, I'm asthmatic, so I'm classed as a vulnerable. I'm not shielding, but I am vulnerable, yeah.
So far, the hospital has swabbed almost 300 patients coming up for procedures, and just 1 had the virus. That ought to be reassuring, but doctors told us around 30% of the COVID patients they treated had false negatives with this test. So they have to rely on strict procedure, including expecting people to quarantine, and that's tough.
It is a huge thing to sit in one room for 2 weeks when you're completely well waiting for something to happen. But unless we can reasonably rely on people self-isolating for 2 weeks prior to the procedure, the natural response is to up our infection control measures, which reduces our productivity. For instance, on a normal, if you like, or average all-day surgery list, I would say we're able to get through probably between 50 and 60% of the activity that we would normally do.
This was Duncan Murray preparing to enter intensive care a couple of months ago. But these restrictions have been relaxed as the COVID caseload has eased and normal business has not yet resumed in full. Well, this is the reality of intensive care today. There have been no COVID patients on this unit for weeks. But of course, perception is a different thing. Fear is still playing a big role, and uncertainty too, prompted by the unknown properties of the virus. Of course, this crisis is not definitively over. They may have to scale up again for a second wave, and in the meantime, they'll have to run the hospital with anti-COVID precautions. Clinical psychologist Kate Jenkins, who herself was badly hit by the virus, has counselled staff as they've responded to several changes of rules. The next one, requiring masks in public areas, comes in on Monday.
When you've spent 6, 8, 10, 12 weeks doing it one way and then someone says, oh no, hang on, we've got to do it a different way. You say, well, why didn't you tell us that 3 months ago, and why now? Because actually someone said to me, the stable door has shut and the horse is about 8 miles over there. So it does seem odd, I think.
As the number of cases drops, wards assigned to treating COVID are switched back to their previous roles, and exhausted staff have started to long for some time away.
I think it's been incredible how people have responded to those changes. So we do just get on with it. But yes, we are tired. But equally, the flip side to that, everyone is able to take some leave now.
Do you have a holiday planned?
No, Glastonbury. But it won't be. It's my yearly retreat that I go to. I love it. So no holiday booked.
In among all the difficulties of getting the hospital back to normal, people here also reflect on positive memories of the COVID surge, having the support of the community, of teamwork, and of long nights on intensive care crowned with success.
It was at the end of a night shift and the patient was in the bed next to me, had been extubated, so he was off of his ventilator. We were able to turn his bed around to face the window and we watched the sunrise. That was stuck with me forever.
Okay, Mr. Mayor, take a big breath in now.
In radiography, Tom Mayer's x-rays are processed. He will get the news he's hoping for. His lungs have cleared of their post-COVID shadows.
Okay, you can relax, we're all done.
Salisbury's hospital is not yet back to normal. There's still so much to be done. And here, as across the country, it really isn't clear when the health service will be back to full capacity.